Hi, good morning. My name is Myrdine, and I am a nurse here at the Neponset Health Center. I am a nurse case manager for the Orange team. I am going to show how I would do a routine call for one of our providers. We call patients about labs or any other concerns that we have. If we're doing a care plan, we try and call and contact the patient and touch base with them. This morning, I'm going to show you a simple call after I spoke to the provider about a positive lab. This patient has strep throat, so I will call the patient, see how she's doing, and follow up on medications, any interactions, and basically how she's feeling. Okay? Good morning. May I please speak to Sherry? Hi, Sherry. My name is Myrdine. I'm calling you from Patty Rosenfield's office at the Neponset Health Center. How are you? I'm good. So Dr. Patty wanted me to call you. Basically, we wanted to know, how are you feeling since yesterday you were seen for a sore throat? You're feeling about the same, yes, okay. So your labs, is this a good time to talk? I'm sorry. Yes, okay. Your labs, your culture, your throat culture came back positive for Streptococcus group A. And this is a overgrowth of bacteria that causes sore throat. Yes. So Patty, Dr. Patty asked me to call you. She's letting you know that she's sending amoxicillin, it's an antibiotic, to the Osco pharmacy on Morrissey Boulevard. Is that the pharmacy that you typically use? Okay, so that it's there to be picked up. Yes. Your chart states that you have no drug allergies. Have you had any reaction to any medications that have been given to you in the past? All right, that's good. So this medication, you're to take one tablet every day for 10 days. Yes, 10 days. Even if you are feeling better before the 10 days is over, make sure you complete the entire medication regimen so that the infection can be totally cleared and that it doesn't come back. We also want you to continue the warm saltwater gargles and make sure you keep hydrated with, lots of water. If you're not feeling better by the time the 10 days is over, make sure you call the clinic and we can reassess, to see what is going on. I see in your medication list that you are on birth control. Are you taking that still every day? All right. So studies have shown that antibiotics sometimes can interact with birth control, and it may not be as effective. So we are advising that you use condoms if you are sexually active the entire time of your treatment, and also a week after you have completed the treatment, so that you can prevent pregnancy. Do you have any questions? How did you get this strep? Okay, so strep throat, it's very contagious. It's passed directly from person to person. So if you're living with someone or you have family, and if you are sharing utensils, if you are coughing, not covering your mouth, it can be spread very quickly. So we advise that you wash your hands, you cover your mouth when you cough, try to avoid being in close proximity with people until you've taken your medication for at least 24 to 48 hours so that you can prevent spreading of the strep throat. Yes. Okay, I hope you feel better. Call us if you have any other questions. Thank you. Bye. As you see, we just called the patient and followed up with her visit from yesterday. We reviewed the visit, reviewed medications, teachings. If you call the patient and the patient is not home, leave a generic message stating what care team you're on so they know when they call back who they are asking to speak to. You try and make sure that you are calling the right patient for the right provider. So try and review the patient's chart before you call the patient so that you have all your ducks in a row and you can have a smooth telephone call with no interruptions or confusion. Verify allergies despite what the chart says. It's always good to re-ask the patient because something may have come up in that time span. Review the medications that may interfere with the new prescriptions that have been prescribed. Last but not least, document. Everything you spoke of, everything you told the patient. If you felt the patient understood, you write it. If you felt the patient didn't understand, try and reiterate the information to the patient and document everything that you say.